Welcome to the program. We're all Doc Alan Lindeman and Doc. What's going on, man? How are you?
We're doing really well here, Neil. And you?
Oh, fantastic. And our topic, I can't believe I never thought I'd do a podcast on this. Syphilis. What is syphilis, Doc?
Well, I tell you, it's an old illness. It is a gram-negative bacterium, and it's often referred to as a spirochete because of its shape. Discovered or first identified in 1905.
All right. How is it spread, Doc?
Well, it is direct contact with a syphilis sore. So with vaginal, anal, or oral sex between humans, this is human to human transmission, and it caused a lot of trouble in the 1900s as far as morbidity and mortality.
How long has syphilis been around?
That's a good question. It depends on which continent you're looking at, but in North America and South America, 9,000 years, according to skeletal remains. It was introduced to Europe by Christopher Columbus. So you see, they got a lot done here in their a few weeks they were here. It was first introduced into Naples, Italy in 1495. So 3 years after Christopher Columbus got to the New World.
Okay. Can pregnant women spread syphilis to her baby in the uterus?
Well, unfortunately, yes. And the information on this is conflicting. It's been traditionally thought that the only way that a baby can get syphilis is when the baby passes through a vaginal canal which has syphilis in it. But there are also a lot of people who don't think that way and who think that it may actually ascend. In other words, travel up into the uterus, around in the amniotic fluid to the baby before delivery. And it can be, at least thought by some people, to be implicated in preterm birth and in small for gestational age babies.
What are the four stages of syphilis?
Well, there's primary syphilis, which is characterized by a painless sore. It's called a chancre at the site of infection. There's secondary syphilis, and that it comes on after the sore heals. There's latent syphilis, which can wait for 10 or 20 years without any outward symptoms. And then finally, there's tertiary syphilis, which occurs after 10 or 20 years in untreated people, cause trouble to the heart, the brain. It can cause trouble with neurologic problems, dementia, personality changes, and blood infections, as well as joint infections.
What are the symptoms of syphilis?
Well, sores, fever, swollen lymph nodes, fatigue, those are those are the symptoms that appear in secondary syphilis.
How do you make the diagnosis?
Well, it's blood tests and swabs to look for the gram-negative spirochete bacterium.
What is the treatment for syphilis?
Well, it can be treated most often with penicillin, and if you are allergic to penicillin and not pregnant, they recommend erythromycin. Sometimes they actually recommend if you are allergic to penicillin to go through a process of becoming not allergic to penicillin. That's a big deal.
How do you prevent syphilis?
Well, by avoiding things that you shouldn't be doing in the first place. In any way, make sure you should be relatively monogamous. You should avoid sex with people who have syphilis or who know you have syphilis. Condoms actually help, not 100%, but probably would offer some protection.
What is congenital syphilis?
Congenital syphilis. I'm having as much trouble with this as you are. It's not sniffles, it's syphilis. Anyway, syphilis, congenital means passed on from mother to baby, or baby is a born with. So, how do babies get syphilis? Well, they get it from their moms, and they do, of course, develop symptoms after they're born.
The best place to go is world.allen.com and pick up Pregnancy Your Way, available